The U.S. has passed a grim milestone, more than 1 million confirmed cases of COVID-19.
We continue to mourn with thousands of families across the country whose loved ones have been stolen from us by the invisible enemy. We grieve by their side as one family, this great American family, and we do grieve. We also stand in solidarity with the thousands of Americans who are ill and waging a brave fight against the virus.
But there are some signs social distancing measures may have flattened the curve. There are no longer exponential increases in new cases, hospitalizations, or deaths in large population centers.
But we're still, by no stretch of the imagination, out of the woods there. It's just stable. We're not seeing substantial declines.
President Trump has consistently sounded more optimistic than his medical advisors.
I think what happens is it's going to go away. This is going to go away.
But a vaccine is months away at best, and there is still no known effective treatment.
So it's not going to disappear from the planet, which means as we get into next season, in my mind, it's inevitable that we will have a return of the virus, or maybe it never even went away.
The virus has gutted the U.S. economy, unemployment up by record numbers, and GDP down by levels not seen since the financial crisis of 2008. Experts say a full economic recovery is closely tied to stopping the virus.
Ultimately, the biggest question is how long, how deep is the current contraction? And then what is the magnitude and the strength of the rebound? It's impossible to answer both of those questions right now. The most serious question we really need answered to have the resolution of the economic problem is the medical question. When can we have a vaccine? When can we have treatment for COVID-19 that we can be confident about?
Public health officials warn that reopening too quickly or without appropriate safeguards in place could lead to a second wave of infections.
Social distancing will be with us through the summer to really ensure that we protect one another as we move through these phases.
More than half of U.S. states have plans in place to allow limited reopening of some businesses, but there are no immediate plans to allow large-scale gatherings like sporting events or conventions. Jim Spellman, CGTN, Bethesda, Maryland.